a high of 90% per 100 live births in 2017 to 41% in 2022, according to the newly launched 2022 Kenya Demographic and Health Survey Key Indicators report. Similarly, the country's fertility rate has dropped from 3.9% reported in 2014 to 3.4% in 2022, among other milestones reported the last KDHS document of 2017. Let's now join our reporter Gloria Milimo, who is at our city center studios. Good afternoon to you, Gloria.
Good afternoon, Purity. Indeed, just like you've put it, this is a crucial document, and remember, it's released after every 5 years, and it highlights the development and social demographic indicators that helps in terms of planning with the aim of steering an economic growth of a country. So remember, just like you've said, this document has highlighted various issues that will help propel this. In terms of fertility, we've also, like you've mentioned, we've seen the fertility rate has dropped, meaning that right now, currently, one woman is able to give birth to at least 4 children, unlike before when these numbers were more than what was released today. And this also means that the uptake of family planning is also on an upward trajectory, given that women now are able to space children and give birth to a number of children that they can easily take care of. When you look at the uptake of family planning, Purity, nationwide, in terms of modern contraceptives, the uptake is at 57%, and when it comes to traditional methods of family it's at 6%, with the national average being at 63%. From the data released today, Purity also, it also shows that injectables, modes of family planning, the likes of depot, it's at 20%, followed by implants, which is the most preferred method of family planning by women, which is at 19%, followed by the pill and IUD at 4% respectively. When it comes to family planning by county, we're seeing that counties like Kiambu, Kirinyaga and Embu are among the counties that have been ranked top in terms of the uptake of these crucial services. And this demand for family planning, however, in some counties, unfortunately, these are counties that are also grappling with issues with teen pregnancies, most of them being in the northeastern. We have the likes of Wajir, Mandera, and also in other parts of the country like Samburu, where the uptake still remains low. Another issue worth noting is that the burden of under 5 mortality has reduced from a high of 90% back then in 2017 to now at least 41%. And the Ministry of Health, in conjunction with KNBS, attributes this to women now embracing skilled care, unlike before when we would see women just giving birth under unskilled personnel, and would have issues of maternal mortality and even deaths among children under the age of 5, others under the age of 2, and also neonates. Other indicators also that were mentioned, Purity, have to do with matters nutrition. And from the report, we're seeing that stunting cases have reduced significantly to around 18%. However, wasting, we're still grappling with issues to do with wasting. And when you look at the national statistics, stunting currently is at 18% and wasting is at 5%. Then we have issues to do with overweight, which is at 3%. Other social issues that have been touched on matters to do with gender-based violence. Remember, Purity, this is an issue that during the COVID-19, at the height of COVID-19, we really experienced a spike in number of cases that were reported in the country. And from the report that was released today, we're seeing that physical violence against women remains a major issue in the country, standing at 34%, and also gender-based violence among men. This is physical violence, stands at 27%, meaning that more women are likely to face gender-based violence compared to their male counterparts. When we break it down to county, physical violence by county, we're seeing counties like Bungoma, Bungoma, Homa Bay, Migori, and Murang'a being ranked among the counties that are grappling with this challenge. Counties where cases of physical violence have been reported, and Bungoma leads this pack with a 62%, followed by Homa Bay with around 54%. Other counties to say that are safer for these genders actually that have reported least numbers of physical violence. We have countries in the northeastern like Mandera, Wajir, Marsabit, other counties like Kericho and Kitui. And when it comes to sexual violence, remember, this is also an issue that we're still grappling with as a country. And when it comes to matters like incest, we'll find families tending to solving these issues without taking them to court and all that. So in terms of these cases by county, we have Bungoma County that leads in terms of these cases at 30%, followed by Homa Bay at 23%. We have other counties like Murang'a, Nyandarua. So these are some of the issues that we will be highlighting in our subsequent bulletins. Actually, Purity, just to give our viewers a comprehensive breakdown of what this report means to us and what we need to do as a country in terms of just addressing our maternal health indicators in terms of even development. So they will get a comprehensive report